Hello, very good evening to all of you. Welcome back after a long time. Today we are going to discuss the case note of Mr. Nasser Ali, who is an Afghan national who has recently undergone a CABG and is about to get discharged soon. Right now, let's go with the case here. The patient name is Nasser Ali, and today's date is 19 February 2012. So Nasser Ali, who is diagnosed with myocardial infarction, was admitted to the hospital on 9th of February. You can see that. And we have seen that he has undergone a coronary artery bypass graft. So important information we have selected. Now we do have to see what exactly is our task first. Now let's go ahead to the task. You are going to write a letter to the social worker, Sarah McDonald. So you're writing to a non-medical professional. So you're writing to a social worker, explaining the patient's situation and needs. So here I'm going to focus on the patient's social crisis or financial crisis, financial situation or social crisis and his requirements. I'm not going to focus on the medical aspects because I'm going to write the letter to the social worker and not to a medical or a paramedical professional. So you are a medical professional and you're going to write this letter to a non-medical professional. So this is the thing. So let's go back to the Nasser Ali's case note. Now I have to select very relevant things here. I just want to say where he had MI and CABG. Just I just can say that he's a smoker. If possible, you can say he has high blood pressure, even though it's not something relevant. If you want, if you have space, you can accommodate that too. It's not mandatory to write that thing. But you know that smoking is something related to social thing. So you can write that. We have to write that here in this particular letter. Now, if you go ahead, no, we don't need these things because we are not going ahead with any treatment or medications of Mr. Nasser Ali. Now we have, as far as we are writing the letter to the social worker, we are going to write the social history in detail. Now, let's go ahead what exactly the condition is. They are refugees from Afghanistan. I don't need, they arrived by boat or by airplane or something. So they arrived and they are living in Australia since 2010. So now it's almost 2 years past. Almost one, so it's 2012, now it's 2010. Okay. Now this is, he has 7 children, 6 months to 22 years. Fatima Ali is a wife, employment, he's a taxi driver. They live in a rented flat, no family doctor. Now he attends TEFI English, but only has basic English conversational ability. And this is what we have to write here. We have to focus on these particular data we need to say something about his medical condition that should be in general, and I don't think that you have to detail the medical condition here, as far as you're writing this letter to a social worker and not to another person. Okay, so we have the follow-up plan. What we can see in the follow-up plan, the discharge plan, many often you get confused, and some of my candidates write all these things here as far as they are told that discharge plan, nothing can be omitted. So this follow-up appointment made with cardiologist, 26 June. Order medication from hospital pharmacy, explain usage, stress importance of taking medications regularly as directed. Arrange for dietitian to provide dietary advice. Discuss the importance of giving up smoking and provide advice on available quit smoking programs. Advise patient to continue with the exercise program recommended by the hospital physiotherapist, particularly deep breath exercises with TriFlow. Arrange for a community social worker to provide a support service to the family to ensure the smooth transition back to life. Now, this is the last thing. So we have a lot of things here. Now we are focusing on this particular thing. You are going to arrange a community social worker. So this letter is written to the community social worker. For what we are writing is that we need to provide Mr. Ali support service to his family. So social worker is not going to give medications, is not going to arrange a dietitian, or it's not going to go with the follow-up appointment with the cardiologist. What the social worker is going to do is that he or she has to help Mr. Ali and family to ensure a smooth transition back to normal life. Along with, we have the quit smoking programs. This is also a responsibility which is bestowed upon a social worker. So we can write that too. And this is what we are going to see here. Now, let us go ahead with the letter. Now, we are going to write, today's date is 19 February 2012. Miss Sarah McDonald, community social worker. It was there in the case note. Write a letter to the community social worker. So the community social worker, address clear. Dear Miss McDonald, the surname, Mr. Nasser Ali, date of birth, 04 February 1964. That's the date of birth. Clear. Now, let's go with the main part of the letter, the purpose. I'm writing to request your service of the social worker for Mr. Nasser Ali, for whom you need to give the service is to Mr. Nasser Ali, an Afghan refugee. Yes, and nationality is highlighted here. So the importance is highlighted. So the importance of this letter is highlighted. He's not an Australian national. He's an Afghan refugee. So Nasser Ali is an Afghan refugee. I'm writing this letter to request your service for him until he could maintain a healthy life to resume his support to his family. So I understood that he was supporting his family. He is not healthy at present. So we need support service for Mr. Nasser Ali to maintain a healthy life to resume his support to his family. So a brief summary is given here. A lot of meaning is there in this particular sentence. Nationality of Nasser Ali, this difficulty, so he is not from this place. What he needs, what he was doing, all these things are there. He's recovering after a heart surgery and is being discharged today. Many often you write coronary artery bypass graft. I don't think that's wrong. It is correct. But as far as we are writing to the social worker, you just need to say that's a heart surgery and he's been discharged today. Okay, let's move on to the first paragraph. If we are moving to the first paragraph goes like this. Mr. Ali is a taxi driver by profession and has been here means Australia, since 2010. He lives in a rented apartment, so he don't have a house. He doesn't have a house. He lives in a rented apartment with his wife and 7 children. So we are highlighting something very serious. 7 children, the eldest is 22 and the youngest is just 6 months old. This is the difficulty. Now he has 7 children. He is the sole breadwinner of his family and has no family doctor. So these are the difficulties. I'm presenting the difficulties, the condition, the social crisis, the financial crisis of Mr. Ali is being highlighted here. Neither Mr. Ali nor Mrs. Ali is proficient in English. However, the former speaks basic English and attends TEFE classes. Now, they speak their native language. They are not proficient in English. But the former, I mean, Mr. Ali speaks basic English. Now he attends TEFE classes. It's a class which is meant for the foreign nationals who come to Australia as migrants. It's a support classes. So that is done after employment. So they'll be having a specific time. They'll attend that. It improves their language ability, the linguistic ability. And they teach about the language, the culture, and some of the rules and regulations there. So Mr. Ali was diagnosed with myocardial infarction and has undergone a cardiac surgery. This is his medical condition. Although his condition is stable at present, his family needs both financial and social support until he resumes his work. So till the point he resumes his work, so his family needs both financial support and social support. And this is what we have seen here. Now, the last paragraph. In view of the above information, it would be appreciated if you could provide the aforementioned assistance to Mr. Ali and his family to bring their life back to normal. I'm not going in detail. I'm not going specifically, I need this, specifically, I need this. I'm not going to do that. I said, I just want to say that Mr. Ali and family needs your assistance. I have mentioned financial and social assistance. It's imperative to include Mr. Ali in some quit smoking programs since he's a habitual smoker. Now he is at risk of cardiac problems. So he is a smoker. So it increases the vulnerability of the condition. So you please include him in some quit smoking programs that would be beneficial for him. So that's and now the closing. If you have any further queries, please feel free to contact me, your sincerely registered nurse. Now, Mr. Ali's letter is a little bit brief. I just want to, I just want you to look again. So this is salutation and all these things. Purpose paragraph. The first paragraph, the social history. The second paragraph, the medical history. The request is made in the last paragraph. So we have selected very brief things. So we have selected as per the data which are required to the social worker. So we have omitted a lot of data, medical conditions there, which are irrelevant there. Thank you once again. Have a nice day. Thank you.